PR's Top Pros Talk, the evolution of healthcare communications, featuring Ryan Lilly, Senior Vice President and Managing Director of MWW Health. And here's your host, Doug Simon.
Ryan, you have the unique experience of building a health practice at an agency, and now you're getting a chance to do it again at Mike Worldwide. What would you say is the key thing to keep top of mind when trying to build a health practice within an agency?
Yeah, I think it's a great question, and an answer that probably looks different today than it did 2 or 3 years ago. I think balance is really the key when you're talking about modern healthcare comms and marketing. Healthcare absolutely is complex. It's highly regulated. It requires specialization to sort of understand all the nuance, all the pitfalls. With that said, you can't approach it purely from that lens. You have to let some creativity in as well. So I think, focusing on that specialization and the ability to get in the weeds and speak the language, but not allowing that to get you stuck into sort of because we've always done it that way methodology, where you can still push the creative envelope a little bit.
Are there any markers, say 3 months out, 6 months out, a year out, that you should be targeting if you're at an agency looking to develop this type of practice or in any kind of vertical?
In my experience, inherently, your early days building are going to be spent doing more pursuit, doing more outreach, going to more conferences, shaking hands, some of that old school prospecting. But I think in parallel, it's absolutely critical that you do brand building, you do, eat your own dog food. And very quickly, hopefully within 6 months, 12 months, you start to see the ratio shift a little bit from, full out pursuit to driving a more consistent inbound pipeline. And that will come with brand reputation, brand equity, and validation of the work you're doing.
Healthcare obviously has been going through a transformation. And how does that specifically affect the communications function?
Even before the pandemic, healthcare was sort of in the midst of really a generational transformation. Really what I'm talking about is the financial model on the provider side of medicine, where we are moving increasingly towards value-based reimbursement, value-based outcomes, and we're looking for value instead of volume, right? Traditionally, in a fee-for-service model, we run as many tests as your insurer will pay for, and we're going to get reimbursed for those. And that really sets the foundation for how the health system operates across subverticals. So now we are moving towards value-based care, which is a tremendously positive thing for anyone that's a patient, and we all are. So I think that was already happening, and then layer on top of that a global health pandemic, which really brought 2030 to healthcare a decade early. We saw mass adoption of telehealth. We saw digital therapeutics become mainstream. We saw Operation Warp Speed bring a vaccine to market on a global scale in months, where that would have traditionally taken years. So I think, the combination of the market is evolving, the industry is evolving itself, but also bars have been reset in terms of what stakeholders expect, but really across, whether it's health system executives, pharma execs, physicians, nurses, everyone's sort of expectations have been reset, I think.
Interesting you mentioned value-based care. Probably 5 years ago, we did 0 projects related to value-based care. Since then, they make up a significant portion of our portfolio, explaining that to the public. One issue that's been a challenge for healthcare communicators, or an excuse, depending on your point of view, is the fact that it's a regulated industry. Are things that you can do within that risk-averse environment? No one would suggest pushing the envelope, but can you still do good communications in that risk-averse environment? And how do you go about that?
This kind of goes back to that theme of balance for me, right? Because the risk aversion is in many ways warranted. It is highly regulated. We are dealing with personal health information, protected data. The stakes are high, whether we're talking about, a patient's survival or well-being, or a DOJ investigation, or, running afoul of the FDA. these are all very real things that you have to keep in mind. With that said, you can't fall into this, we're going to reuse the playbook over and over. We've solved this once, and then we're going to do it 1,000 times. I think you do that by forcing yourself to ask, why are we doing it? Who's the beneficiary? Who are we talking to? And increasingly, I think communicators are taking that all the way down the path to the patient, to the human level, which forces you to get out of the weeds of the regulatory, of the science, of the bits and bytes, and speak a little more to the human impact. And I think, anyone that's in healthcare comms, hopefully is interested in what that human impact looks like.
Just want to clear up and get your take on a couple of quick regulatory things. Obviously, marketing off-label is not a cool thing to do, and things that affect patients' privacy rights, that would be a place that you can't go as well. What are some other don't do's that people need to be aware of if they're trying to even be more aggressive with communications?
I think always protecting the patients and privacy is bubbles up to the top very quickly. And you sort of mentioned, I think there's increasingly a number of ways that you can violate that sort of privacy, whether that's through data mining or non-ethical use of that data, or just exposing a patient. I think often this happens in a way that we think is veiled enough, and then it turns out that it might not be. So I think no matter what, do no harm, protect the patient, protect the people has to be sort of the North Star for any healthcare comms pro.
Do no harm is the Hippocratic oath of PR as well. You talk a lot about a patient-first approach. Can you explain what you mean by that?
Again, I think it's not losing sight of the end result, right? So even if you are a B2B technology vendor that is selling into hospitals and health systems around workforce management or physician credentialing or whatever it may be, really these are operational tasks, they're practical problems, these are solutions. But at the end of the day, those solutions are empowering this human capital, the physicians, the clinicians, to provide care to patients, right? And I think if you look at almost any healthcare brand, you can connect the dots to the end result, which is hopefully improving quality of care and taking care of patients. And I think by doing that, it forces us again to sort of get out of the weeds, drop some of the lingo. Let's talk. Let's dumb this down and tell a story that is really meaningful to a larger audience, not just a handful of admins in hospitals and health systems.
Yeah, and obviously the pandemic made healthcare communications even more important, where I remember saying to my team, there's no such thing as a non-pandemic related story because everything was related when it first hit. We also find that the TV producers constantly say healthcare is their number one interest when it comes to subject. More than 81% of them said that in our last survey. Anything that you see, if you look into the crystal ball in the future, that healthcare communicators should be thinking about, maybe putting more emphasis on as we wrap up the conversation?
Pushing the creative envelope a little bit, right? And again, it's balance because this is one of the biggest challenges I've found is how can we push our clients a little bit on the creative front, but also knowing that if we cross that line, we lose credibility, we put them at risk. So I think increasingly knowing how to sort of toe that line and how to sort of borrow PR and marketing lessons from other industries, right? And you could look at banking or finance, complex, highly regulated.
Of course.
So I think continuing to push in that direction, while still acknowledging that the risks are real, the guardrails are real, and they're there for a reason. But we can't allow that to be an excuse to just do the same old thing over and over and over again.
Yeah, that's a great point. And you've clearly shared that your approach isn't to do the same old thing over and over again. Thanks so much for spending time with us.
Thanks for having me, Doug. I appreciate it.